Okay.
We can hear you.
Okay, good. So I am Dr. Munson. I am filling in for Dr. Burchett today, a little more hair. That's really your only difference between us. And I looked through our list and I think we have our quorum, but let me make sure. So we got Steve, I can see, Gary, and then Dr. Sawyer. Everybody's on. By the deafening silence, I'm going to take that as a yes. Actually, if you will, James and Dr. Upchurch, will you unmute and say hello so I can make sure you're here, and then we'll go ahead and get started.
I'm here.
Hi there, Dr. Upchurch.
And can you hear me?
Hey, Dr. Sawyer. Okay, great. Thanks. So we do have a quorum. And then our first order of business is reviewing our minutes from the last meeting on the 5th of May. So I will entertain a motion.
Madam Chairman, Steve Compton, I move to approve.
Second.
All right. Thank you, gentlemen. Okay, so we'll go ahead and we'll move into our old business, which is section 4 on our agenda today, which is our first question is for DMS. Our code 66982. Can anyone update us if that has been added to the vision fee schedule?
I did submit the change order. This is Kelly Kitchen. I submitted a change order to have that added. It does take some time for systems to do all of their work to allow that to be payable. So we're just waiting on that to go through, and then we can go ahead and add it.
Do we have an estimated time on how long that process takes?
I'm going to say up to 30 days. It should be sooner, but it should be sooner, but I'm going to say 30 days just to be safe.
Okay. And then is that something that you can let us know when that does go through?
Yes.
Okay. Awesome. Perfect. Thank you.
You're welcome.
And then next we have a VISUS, the termination re-credentialing process. We have had, as the KOA, we do road shows in the summer, which we take our our show on the road. So we go more regionally, allowing our members to come in and kind of have an open forum. And we are almost done with them. I think we finished tonight. And at every roadshow, we have had several providers that have talked about being removed from a VISUS, and they were not given any notice. The only reason that they knew is because the patients called in and said, "Oh, I can't see you anymore." The last meeting that we had, a VISUS told us that they were getting letters out to those folks. But when we talk to our members, the members are not seeing that on the back end. Even we had some folks that had staff members in their office that received that letter at home saying that provider was no longer able to provide services. And they never received a letter at home stating that that was an error, that provider was indeed credentialed and able to see patients. So that means the offices are having to follow up instead of any communication from the insurance company for that mistake. And so one of the offices asked for a list of patients who had received the notice. And so even the office could follow up and clarify with those patients, and it has not been received to date. So is there anyone that can speak to that? I don't know if Nicole is on the call, but we need to know what kind of notice they're getting, when they're getting it, because I don't think that this is something that's resolved and it's actually impacting our members across the state.
Hi, Dr. Munson. This is Shelley Granger. Can you hear me?
Yes, ma'am.
Okay, I'm going to speak on behalf of Avisus today. And we did send quite an extensive list of the reinstatement letters to the members of the providers who were reinstated. But we do know that there have been some that may have not received it. So we are going to ask that those providers reach into our provider relations team, Leanne and Miranda, specifically to let them know, and we can definitely generate letters to those members on a case-by-case basis. Other than that, I did want to follow up with what you had mentioned about an office asking for a list of members who would or maybe did not receive the letters. And we absolutely would want to follow up on that as well. So if you could let us know who that office was, or if you wanted to just send an email to me after the meeting, I can make sure that that's taken care of.
Okay. So what I'm hearing is that this was an issue. This was definitely an insurance error that was sent out. These providers were still credentialed and were still able to see patients.
No. I want to make sure to clarify that. No, they definitely did fail to re-credential. And so then we needed to terminate them, and or maybe their information wasn't updated in the Kentucky master file that we receive timely, because as we know, it takes 2 to 3 weeks to receive that information. And so we cannot continue to pay those claims and send in encounters if the provider's information has not been updated on that master file. And so that was kind of causing a lapse. And that was because we had so many providers coming due at the same time earlier this year. That is what did cause, I think, an overabundance of that situation. And so we did our best to work to get those reinstatement letters. First of all, to get the providers reinstated and all their credentialing up to date, and then to get letters out to the affected members. So again, there might have been stragglers since that initial list that we did send out the bulk of the letters that were missed. And so we definitely want to help to clearing that up.
Okay. So Leanna, Miranda are the two that they should direct any of the issues to, basically, with this problem.
Absolutely.
Is that correct?
Yeah, absolutely.
Okay.
And then for you, Dr. Munson, or anyone with the KOA, if they've got things that, these situations and they're not able to get in touch or answers quick enough, you can certainly reach into me.
Okay. Do you mind to put your email in the chat for
Sure.
me? Okay. Thank you. Okay. And then there is one other question for Avisa specifically that has been discussed in the past. This is actually a favorite of Dr. Burchett, even though he's not with us. He wanted to clarify that a refraction is covered during the post-op period for cataract surgery patients. So, the post-op period is 90 days. They're coming in 3 to 5 weeks after surgery to get different glasses. That is a medical refraction, and wanting to make sure that that is indeed something that is covered.
Yes, and I was prepared to speak about the refraction code separately from when it's coming in with a medical exam versus routine. But I'm going to actually defer to Dr. Worth or Danny, if you could speak up about the cataract surgery question specifically, please.
Sure. Hey, Dr. Worth here. Yeah, absolutely. As you know, it's a medical exam. So if they're doing a refraction at that point, it should absolutely be covered.
Okay.
Yeah, plain and simple. And if not, if they're getting denials, please send them to me. I'll take a peek at them.
So this is the screenshot that I was given, is that it is not eligible for payment when it is billed on the claim alone. So a post-op period is billed one time because it's a 90-day. And, if you're going to see them at the end of their post-op period, again, 3 to 5 weeks out from surgery, the only code that you're going to have to bill is that medical refraction, because you can't bill anymore on a post-op claim because it's a 90-day global fee.
Right.
And that's going to be billed, day 1 of post-op. It's not going to be billed at, week 5. So this is the screenshot that Dr. Burchett had sent. So I think that's why it's unique to our line of questioning, aside from just, you have a diabetic that comes in the medical exam and a refraction that's billed. So I assume the screenshot had come from Avisa's.
Yeah. Maybe send that over to me. Let me take a look at it. I don't want to answer, incorrectly. So let me take a look at that, and we'll certainly get back to you on that. Okay.
Okay.
I want to make sure we're on the same page. Yeah.
Okay. I can have that sent on. And then if you'll put your email in the chat box for me, that would be helpful.
Yeah. Shelley will take care of that. Sure.
Okay. Thanks, Shelley. Okay. So those are the 2 questions specific to Avisa's, an old business. And then yes, sir.
This is Steve. Can we backtrack just a minute to that
Absolutely.
letter that was sent out? Just to make sure I understand. none of the providers, and I'm one of them, we had no notice that we were about to be dropped. Is that correct? We didn't get one.
Yeah, that is my understanding. There was no notice that was given.
And we're supposed to reach out on a case-by-case basis, but we have no idea who got the letters and who didn't, other than the 45 people that have called my office. So, I mean, I'm thinking, looking forward, maybe just a courtesy letter before these mass letters go out to the members next year or whenever. We had no idea. I think this is because you have to credential with Avisus and with maybe WellCare. I don't know. I just know it's all of a sudden that all these folks got letters and we had an issue, and I had people no showing for one-day post-ops and glaucoma patients canceling. And I mean, there's some.
Okay, I'm sorry, Dr. Compton. So it is our practice that we do send a letter 120 days prior to when credentialing comes due. And so are you saying that you did not receive that notice, or you did not receive the notice letting you know that you would be terminated for failure to re-credential?
We did not receive any letter. Now, in all fairness, we moved, we changed locations in January and changed our addresses with every insurance provider we have. And just today, we got a letter from Avisus still sent to our old address. So it's certainly possible it could have been sent to the wrong address and we never got it.
Okay,
But
okay.
you still haven't updated because we got a letter today. I've got it here on my desk, sent to the old address. And we changed that 7 months ago.
All right, well, we'll certainly make sure that we've got your updated information, and we have made improvements because we do know that that's happening quite often, that offices are moving, contact information is changing. And so we are working cohesively to make sure that we've got all of our systems aligned so that we can get better and stronger with that communication.
I think there's a better way you could do it if it going forward.
Right.
Somehow get in touch with the providers to save you from sending a whole lot of letters.
Agreed.
And in this discussion, and quite frankly, there was some issues with patients not receiving proper medical care because they canceled or no-showed.
Steve, this is James. I had the exact same experience, with the exception we didn't move. We had no letter, no information, no anything, because you talked about it at the last TAC meeting. And then I was kind of hearing all that, thinking, boy, we've dodged one there. I'm glad that didn't happen to us. And then it did. And it's been a nightmare.
This is Angie from Medicaid. Has this been reported to DMS prior to, and is this just recently?
Hello, Angie. This is Nicole with Avisus.
Okay.
To answer your question, yes, this is all of, I would say all, but in regards to the letter of concern regarding the credentialing process that we did address approximately 8 to 9 months ago. So some of this is follow up to that. But just so that everyone does know, Avisus did implement some process improvements to decrease the situations from happening, or to stop these situations from happening in the future. For example, when a provider is up for re-cred, as Shelley stated, within 120 days, if not before, we do send the initial notice out to the provider to notify them that they are due for re-cred. We also invite the provider to attend a re-credentialing orientation so that it's clearly understood what information is required in order to successfully complete re-credentialing. Unfortunately, we haven't had providers attend that as of yet, but we do send a notice out to the providers, and also the PR reps reach out to the practices. So we have increased our outreach to the providers significantly. And Leanne, correct me if I'm wrong, but there's a 120-day notice, there's a 90-day notice, a 60-day notice, a 30-day notice, and then a 15-day notice with phone calls to the offices. When we realize advised that patients were receiving the termination notices from the providers. We worked very quickly with each of the Kentucky MCOs to obtain their approval for a notice of reinstatement. And that's the notice that Shelley spoke to earlier, so that if a provider is termed from the system but does complete re-credentialing or DMS updates the provider status on the DMS in DMS's system, and we can reinstate them. As soon as they're reinstated, we do send a second letter out to all of the members that received the initial letter notifying them that the provider is reinstated. And that's been in practice for about 6 months now. I'm sorry, it might have been 5 months instead of 6 months, but it has been in practice for a while. So unfortunately, right now it appears as though we're seeing the fallout of, but we do have the processes in place to improve, and then also again to prevent it from occurring in the future.
Nicole, how do you know the providers get those 120 and 90 and 60-day letters?
We
I'm
are.
telling you, we didn't get them.
I understand. And Dr. Compton, we can look into your specific case. We'll make sure that, of course, we have your correct address on file, and we'll look at the notification history. In our system, we do document what was mailed out, when it was mailed out, what address that it was sent to. So if you can give us an opportunity, we'll work with our provider relations team. I think you know everybody, Leanne and Miranda, and also our new PR rep, Catherine. Between one of those three, we'll have them reach out to you and your office manager to see what the history was.
Thank you. I will say you got us re-credentialed pretty quickly.
Yes.
I don't know that their members got the letter to that effect. I haven't seen it mentioned.
Yes.
The
letters went out
pretty quickly.
Well, good. Happy to hear that. Yeah, we've been putting our efforts forward, or putting our efforts, to get everything resolved quickly as possible. But each of the MCOs approved the reinstatement letter. DMS approved the reinstatement letter. So as soon as we had that, as soon as we had the approval from everyone, we start sending those out. So your patients did receive 2 letters from Avisis, and we can give you a sample of that. We'll send you a
James
sample.
Again.
Mm-hmm.
Let me just say too, what you're saying, Nicole, Leanne and Miranda did a fantastic job working with us, getting us back online, getting us back in. I did have patients bring letters to us saying that we were reinstated and everything was good to go. Made us feel much better about that, but it still was an ordeal, a long drawn out process at best.
Understood.
And so everything you're saying sounds good to us, that we want to see that happen so that it doesn't happen again, and hopefully it won't. But it's been tough, and patients were pulling out pretty fast. I mean, it was one of those, like Steve's talking about. They were canceling, they were no showing, and we didn't know why immediately, but and then soon got word as to what was happening. Understood.
And we do apologize for it, but we did attempt to, resolve it as quickly as possible. We do have the, requirements that we have, especially for DMS. If a provider doesn't have an active Kentucky Medicaid ID number, we unfortunately, we cannot pay those claims. So we do have to take action on those until things are updated. And the same is true for Re-Cred in dealing with NCQA criteria. But we anticipate, or we think that we've captured all of the processes to ensure that we won't be in this boat again. We've been in Kentucky for a long time, and we haven't had this problem before. We haven't had any issues like this before. So we did again try to resolve it as quickly as possible, and we do feel that our process is solid.
So Nicole, I appreciate that detailed explanation. Just to go over with Shelley giving out her email address, if we have providers that are upset that they were removed and did not receive notice, are they able to email Shelley and get the documentation of the notices that you guys sent?
Right. I would not, and Shelley, I hope you don't mind, but emailing Shelley would be like emailing me. And I am not on the provider side. We're on the MCO, on the NCO servicing side. So we really, really need to get those into our provider relations team. So if you could please direct them to their PR rep team, which is Leanne, Miranda, and Catherine. And Leanne, I think you're on the line. If you can give us the best point of contact, if you prefer that it go into you or one of the reps, if you could please share that with Dr. Munson so that we can document it appropriately.
Hi, of course, I'll do that. So you're saying that any of these questions should go to Leanne, Miranda, or Catherine?
Yes, please. Yes, because
Okay.
they're in provider relations and the providers are their primary responsibility.
Yeah,
So
and Dr.
those-
Munson, I just
Yes,
wanted to
ma'am.
clarify. I think I was just sharing my email address in case anyone with DMS or the KOA or the TAC board, would want to get in touch with me.
Okay, so
Specifically.
that is not directly for any of our
Individual
members with these
provider
issues. Okay.
inquiries
Okay.
should go to PR, yes. Please.
Okay, so and the reason that I'm asking this is to make sure that we have an avenue for these folks, because it's great for Dr. Upchurch, it's great for Dr. Compton, but when we get a bulk of people that come
Sure.
to us at our meetings that are upset, we want to be able to direct them so they are able to get a history of their letters that were sent saying that they needed to re-credential.
Mm-hmm.
If they want to, they're also able to ask what letters were sent to their patients, the names of their patients,
Mm-hmm.
a list. Okay.
Mm-hmm.
And you're able to pull that up and to give that to them.
Yes, yes. So Leanne, Miranda, and Catherine, if you do receive a request for the list of the members, please contact myself or Shelley. And we do have the list in our reporting folders because we do have to report to DMS and the MCOs of the number of members that received the notices as part of the provider termination. So that is something that DMS does monitor with the MCOs, and we report on it on a monthly basis. So yes, we can provide the list of the members.
Okay. Okay. So that's perfect. So we will not inundate you two. We will make sure that the PR reps get any necessary emails from any of our members. So that should give some resolution, hopefully, to this issue. And hopefully the processes that you've put in place will make it where it's a one-time occurrence and not something that repeats.
Yes, exactly. And one other thing, if I may please add, just for FYI, account management, which is myself and Shelley, we do meet with the provider relations, also our clinical management, which is Dr. Worth, on a biweekly basis. So we are in constant contact with them. They notify us of any problems or things that are possibly escalating. I apologize. That are possibly escalating so that we in turn can keep the MCOs informed. I'm so sorry. My little one is traveling back from Las Vegas, so I apologize. But we are, and they are in constant contact with us so that we are aware of any issues, that are impacting the provider community, as well as, keeping in contact with Dinah and Sarah at the KOA. So please, I don't want you to think that it's going into PR and it's going to stop there. Going into PR is just your first contact so that they can put you as a priority to resolve it, and then they will keep us in contact with us so that we know what needs to be escalated and what needs to be resolved before we have situations like this.
Okay, perfect. Okay, I appreciate that. Okay, so doctors on the call, do you have any other questions about this issue? Dr. Sawyer, Dr. Compton, Dr. Upchurch, are we all good with this?
I'm good.
Okay.
I'm good.
Okay, awesome. So then our next question is just a follow-up from last meeting. We had asked that potentially all the MCOs kind of think about frame kits and think about if that's a possibility. Some already provide that, some don't. And so is there any update as far as the MCOs that don't provide frame kits, or if there would become the likelihood of there being a universal frame kit that all the MCOs would use? So I guess we'll go alphabetical order and let Avisa speak first.
Hi, this is Shelley again. I believe in our last meeting, we all kind of agreed that it would not be the best idea to do the universal frame kit. Logistically and administratively, it would be tough. And also just thinking about our members and the kiddos not all wanting to have the same eyeglasses. And I think I really wanted to hear more from the doctors as well. I'm not sure if the MCOs themselves had another meeting not involving Avisas to discuss this issue. If so, we were not made aware of it, but that is my recollection from the last meeting. And I think all the doctors kind of agreed with that standpoint, but if there's more discussion or questions, we're happy to entertain them.
Okay. iQuest.
John Davis from iQuest. Right, I'm kind of concur. That was the consensus. Something else that when we were researching it also, one of the things we talked to when we talked to, one of our labs, they talked about really inventory issues in the present time, like in the last year or so. And then they think it's going to go forward that if they won't be able to get all these frames. So again, if we use one common kit and then everybody in Kentucky and in Ohio and wherever, a lot of that inventory is not going to be available, meaning they can't get the frames that are in your kit. So I think that was a little bit of a fear. I don't know how much foundation there's in that, and I don't know when that's going to change, but obviously all of these frames come from overseas, essentially China and the Pacific Rim and Italy a little bit, but ultimately that was a kind of a fear, or at least an observation from their perspective, because they're dealing with that right now, these big labs that do this stuff all over the country. So I think it was another reason to say, well, let's just do what we're doing. They have to worry about their inventory on their frames, and then whoever is doing the other ones, whether it's the Molina lab or wherever, excuse me, not Molina, but March Vision or whatever, we'll hear from them, I guess. But ultimately, that's really where we are as well. That doesn't mean that I think, going forward and as things change, that we can't potentially get together and try to do something that's more, I guess, a common kit.
Okay.
Right now, we don't think it's a good idea.
Okay. And then March Vision.
Yeah, good afternoon. This is Ann Ritchie with March Vision Care, and we have the same recollection as iQuest and Avisas mentioned that there was concern that we didn't want the kids all having the same eyewear or the same selection to choose from. Again, happy to have further discussions or entertain it. But at this point, I think for some of the supply issues that were mentioned and other items, I think maybe this is something we might want to hold on and maybe even, revisit after the first of the year to see if, there's an ability to get, frames easier, and some of that has kind of smoothed out.
Now, am I correct that March Vision does not have a frame kit currently for Kentucky?
That is correct. So we ask the providers to have the members choose from a frame, in their selection. So that's correct. We're not using a frame kit currently.
Is that something that you foresee changing in the near future?
I know our team, continually, looks at that to see if it would make sense to make that change. We are familiar with the frame kit. We do that in other states. So it's not, wouldn't be a new concept for us. But again, due to a number of the different items that we've experienced, whether it be the the Medicaid ID requirement or some of the supply issues perhaps that have been mentioned, et cetera, we've chosen not to move forward right now. But again, it is something that's continually evaluated.
Okay, thank you. And then in light of the comment on our supply chain issues, which is obviously not unique to our industry, because iQuest and Avisas does have a frame kit, can either of you speak to issues that you have had currently with supply chain issues, or is that not affected the frame kit availability for either of your groups?
I'll go first, John Davis, iQuest. It's only in the colors. They can't get certain colors, is what I'm hearing. Right, like the kit will only include, let's say, 1 or 2 colors, but it's available in 5 colors. So whatever they'll say, well, I want to order the blue one versus the green one. They can't get the green one or whatever, the one they want. So that's because they're not available, because it's maybe too popular or whatever. That's it. It's not so much the individual frame if they're willing to take whatever. And I haven't heard anything about the sizes. Some of these frames come in 2 or 3 sizes. That hasn't come up in our discussions with the labs either, as far as what the limitations are. It's the color.
Okay.
And again, Shelley, with Avisis, I would mirror that as well. We haven't had really many escalated issues regarding the frame kits. Seems to be everybody is getting what they need.
Okay, excellent. Okay, thank you. All right, so is there any other comments on the old business section? Okay, so we will move on to new business. So our first question, or actually our questions are for DMS. So we as a TAC would like to start a conversation to kind of link together the Kentucky Board of Optometric Examiners to be able to electronically send over our license of the optometrist over to the Medicaid department. So is there someone on that can comment on how we can start that process or how we can affect that change?
This is Kelly Kitchen. Currently, they're not able to update their license on the provider portal, because you can electronically update your entire file, including uploading of documents.
Absolutely.
On the
and
provider
I will
portal.
tell you from personal experience, and I'm super good at being an eye doctor. I am not super computer literate, but I feel like I'm decent. The portal is atrocious to find it, to get it uploaded. I don't even do any of that. My billing insurance just says, hey, I put it in the portal, you got to go and approve it. And for me to log in, for me to get authenticated, for me to figure out where it is, to figure out where to click, where to say yes, I authenticated. That's me. That's my license. It takes me way too long. I could see several patients for the amount of time it takes me to wade through that. And probably because I don't have to do it very often, but it would be delightful if 2 state agencies could just transmit the entire batch of files when our licenses are renewed over to DMS. And that's how we would like to know, can that happen? How can that happen? Who can make that happen? That's kind of how we'd like to start this discussion and see if we can move that forward.
Yeah, that would be something we would actually need to pull provider enrollment in on. Probably SAPNA. SAPNA and Rachel would have to be pulled in for that. I'm not sure what their options are other than just the portal.
Yeah,
And
this is
Dr. Munson,
Justin Derringer. I was wanting to just speak a little bit about that. That's something that we definitely wanted to do for a little while with all of our provider types, and right now, you know, we've kind of started some discussions internally. Those discussions will reach out toward some of the licensure boards, and it's going to be there's going to have to be a planning phase, you know, there to get two systems to talk to each other. I'm not the IT person, but those 2 systems would have to talk to each other and transmit data and receive data, and then be able to update according to that data in the system. So I don't think it's an option that's anytime soon, but it's definitely an option that's on our radar, and that we're definitely looking into. So right now it's just trying to figure out how to make that work, and what type of funding that would take to make that happen.
Okay, so 2 things. One, looking at provider groups, we would definitely be on the smaller end of the scale compared to dentists or MDs or nurses or whoever else has to update. So if you needed a sample group, we would love to be that sample group that you would try it out on. And then would you be able to, at our next meeting in November, provide us with an update to the powers that be, or whomever has that data? Is 3 months enough time for you to come back with some form of an answer to that question?
Probably
Dr. Munson,
not, but I can always give you an update in November about what progress we have made and what I've learned, what we found out through our research of, you know, what our next steps look like. So I can definitely give an update. I don't know if I'll have anything concrete by then, but I'll definitely have an update on where we are in our process.
That's perfect.
And Dr. Munson, this is Erin
Yes,
with
ma'am.
DMS. Jennifer Dudinsky had triple booked today and was unable to be here, so I will also put that on her radar. She is the director over program integrity that deals with a lot of the licensure and things. So I will also follow up with her and make sure that's on her radar as well.
That would be awesome. And I understand, like I'm not computer literate, so I get that there's a lot of moving parts, but I think that it would just be good for a lot of different reasons. And I think that, again, we being a smaller provider group would be really happy to be the guinea pigs, because that would be something that, you know, kinks could be worked out with us with a smaller provider group versus going to some of the bigger providers that you have within the state. So that would be great to hear what Jennifer has to say. So I appreciate that part. So then the next question we have for DMS is, do the MCOs have to pay a fee on a covered service that is on the Medicaid fee schedule? Meaning, if they say it's a covered service, that they cannot reimburse the doctors at a $0 amount. So does anyone in the department have an answer on that? So it's saying, yes, we cover that, but we cover it at a $0 reimbursement.
My understanding is going to be based on the contract that the provider has with the MCO.
And who's speaking? Kelly? Okay.
Sorry. Yes, this is Kelly Kitchen.
That's okay. So if the contract reads that the reimbursement will be at a certain percentage of the current applicable Medicaid fee schedule.
Right. Each MCO does have the ability to create their own fees. I know this is something that Jeremy Armstrong's group can speak more on probably. My understanding when I spoke to him the other day was MCOs have in their contracts have the ability to have specific rates listed in the contract.
Can they say it is a covered service and still pay $0?
That I'm not sure. That again, that would be something we would have to ask Jeremy Armstrong's group.
Okay. Are you saying Jerry or Jeremy?
Sorry, Jeremy.
Jeremy, okay.
Jeremy.
Okay. So is that something that we can have this conversation with him via an email? I don't think he's on. Is he on the call?
I don't see him on the call, but you can absolutely send him an email, and he can point you in the right direction if he doesn't have that answer. I know to answer, like Ms. Kitchen said, each contract is different. So, without knowing the specific provider and the specific MCO, would be impossible to answer that question, I think.
Okay.
Dr. Munson,
Yes.
this is Stuart on a WellCare. I thought I just might mention something. So in our contracts with DMS, MCO contracts with DMS, there's a couple of relevant excerpts addressing this. And so this is in the covered services section. So one of them is the contractor, which is MCOs, shall provide covered services in an amount, duration, and scope that is no less than the amount, duration, and scope furnished Medicaid recipients under fee for service. And so then the follow-up, also in that same section, contractor shall provide or arrange for the provision of covered services to enrollees in accordance with the state Medicaid plan, state regulations, and policies and procedures applicable to each category of services. So, to me, if it's a covered service, if it's on a DMS fee schedule, it's a covered service. $0 is not paying for it.
Yes.
We can negotiate different rates, different reimbursement amounts, but to me, $0 is not covering it.
Correct. Yeah, and so that this is irrelevant to Medicaid, but Anthem commercial had done that in the past. And so that was the question of, you know, how can you say it's a covered service if you pay nothing? Or how can you say it's a covered service if you pay a penny for it? And so that's kind of the impetus, because there are covered services on the Medicaid fee schedule that are being reimbursed at a $0 amount. And so that, I don't know if that's something that, if it is a single provider, if that's something that we can ask that on this call or this meeting. So if DMS wants that, it is a specific provider, and I do have the specific Exhibit A from my contract actually that speaks to it, and that's kind of where this question has come up. So is that something that we can be specific to an MCO with this question on this call?
Yeah, if you'll just send me an email, just kind of outlining the specifics, I can forward you to the MCO division and they can go over that.
Okay. Okay. Well, I will get that to you. Okay. Perfect. And then we have general discussion. I do know that Avisis did want to have some time to talk about some help that they're going to be providing for the Eastern Kentucky areas that have been ravaged by the floods. So I don't know who from Avisis wanted to address that, but please do.
Hi, yes, this is Shelley. And so we have made allowances for the 14 affected counties. There is currently an prior authorization waiver in place from July 26th to August 11th. And then we also have a replacement material for repair or replacement of eyewear from 7/26 through 9/26. And so then we've identified all of the providers in the affected counties, and our vision team has made outreach to those providers, almost all of them, and is continuing to make calls, and we'll have that completed by close of business today.
That's fantastic. So 7/26 to 9/26, anyone in those 14 affected counties that has eyewear that was missing due to the floods are able to get that replacement, adult and children?
That is correct.
Okay, awesome. That's very, very nice of you guys.
Of course, we're very sorry for all the devastation and doing what we can to help.
We will definitely make sure that our members are aware that that is an option for any of their patients that have Avisis Medicaid coverage.
And that's the same for iQuest. We were all asked to look at the replacement of eyeglasses. That was a request from the state to take a look at that. And also with prior auth, there were dates given to us that we, I'm trying to find the dates, 7/28 to 8/12/22. It's a PA waiver for in and outpatient. I'm trying to find the eyewear part of it. There's a whole list of things that are being done in most areas. Replacement of eyeglasses and contact lenses. So that's out there for the replacement. And we sent the state the iQuest number so that they can call them for any assistance that they need. And then there's a whole list of other things that, of course, goes on to social determinants of health, trying to help people with making sure that they have shelter, food, and those types of things. I think most of the NCOs have been responsive to what's going on in Eastern Kentucky.
That is wonderful.
It's very heartbreaking. It's very heartbreaking. My daughter works for National Guard, and she's been there, and she's been sending pictures, and it's just very heartbreaking to see what's going
absolutely.
on, especially when you're on the ground. So it's devastating, I think.
Well, we appreciate you guys stepping up and doing those things for those affected individuals. And then next on our agenda, Dr. Upchurch, Dr. Compton, Dr. Sawyer, do you have any other recommendations or anything that we would like to move up to the MAC meeting that Dr. Compton will be attending on the 22nd of September?
I have nothing.
I do not. I don't either. Excuse me.
Okay. Well then, Dr. Compton, we will just have you kind of keep your ears open and see if there's anything that you bring back to us from that MAC meeting in September. And then our next meeting will be November 10th at 1 p.m. I am assuming it's still going to stay on Zoom. We've not really heard anything otherwise. So that will kind of be our thought process going forward, unless anyone has an update on the meeting process.
The next MAC is via Zoom.
Okay.
This is Sarah with the Kentucky Optometric Association. I have a quick question. I guess we could put it under the general discussion. If we were wanting to pull information on like the children's utilization of their benefits, would that be something we could get from DMS, or would it have to come from each MCO? Is there anyone on here that could answer that question? Or and even if we wanted to break down possibly by like county or region, would that information be possible? Or if y'all want to email me afterwards, you can answer that.
This is Angie with Medicaid. Yes, that is something, but we would need we would need specific information on what is wanted and what time frames and
so Angie, so I'll just email you. Okay, so
okay,
I'll do that. Okay, thank you.
Dr. Munson, I just wanted to speak on the meetings, virtual versus in person. So far, we have been allowed to continue the virtual meetings, and we've just kind of left that up to each TAC to decide if they want to start moving, to hybrid or in person. So far, most people have appreciated being able to log in via Zoom. They said they've had more participation. It's easier to still, anyone that might have to travel. So that's just something that you guys can, maybe put on the agenda for next time, maybe moving forward next year. I believe the MAC originally voted they were going to attempt to meet in person in September, and then chose to go back via Zoom because of the rising numbers. So that is, some of the TACs are kicking around the idea of maybe sometime next spring having a meeting in person so that just everybody can be in the same room together. So we've just been kind of leaving that up to each TAC to kind of discuss and vote on as they see fit.
Okay, well then we'll add that to our agenda next time, but then we'll plan for our next one to be on Zoom as well. Thank you for that.
You're welcome. And I will be, within the next month or so, I'll be working on 2023's calendar. So I will hopefully have that email to you guys prior to your November meeting, so you can look at it and make sure those dates look okay moving forward as well.
Okay, perfect. Thank you. And then I did see that Judy from Medicaid was able to pop on. And so I'm going to re-ask my zero copay question, because the answer in the chat is a little different than what I had asked. So is that okay, Judy, if I ask you the question again?
Yes, ma'am.
Okay, so does the MCO have to pay a fee on a covered service on the Medicaid fee schedule by paying $0 for that? Are they able to say that they are paying a covered service if their reimbursement is $0?
It's kind of strange on the fee schedule. If it says $0 on it, it actually pays 45% of the billed amount, not to exceed the usual and customary charge.
So no, that's not what I'm asking. So it's a DMS covered service that has a fee attached to it, but the MCO is saying they're covering it, but it's covered at a $0 reimbursement.
Oh,
they're saying it's a covered service, but they're paying $0 on it.
Wow, I think that's more of an Angie question.
Okay. So is the consensus that Jeremy
Sorry,
Armstrong is still probably?
This is Angie, and I'm going to kick it down the road some more because I know I have heard. Are you talking about zero when it's Medicaid is secondary?
No. Medicaid. They have Medicaid. The Medicaid fee schedule pays $33 for this coverage service. The MCO says they are paying it, but they pay it at a $0 reimbursement.
Could you send an example or
service.
two? Could you send me an
Yes.
example or two so that can?
So should
kinda
that go
see
to
what
Jeremy
yours-
Armstrong or should that go to you?
You could both. It's fine.
Okay.
And Carolyn, this is Greg. I'm the COO for United. I just want to make sure, it sounds like this is coming from specific experience. It sounds like you're having this happen. Is that the case?
It is happening to optometrists across the state. So
Okay. And are you addressing that directly with the MCOs that are doing it or no?
it has been asked of the MCO and they feel that they are doing it correctly.
Okay.
Hence why I'm bringing it to DMS.
Yeah, exactly. So it's our understanding that we should be paying and a $0 payment, we would interpret that as not a payment. So I just want to make sure you have the opportunity to address directly with us if there's an issue. So if I'm just putting my information out on the deck, if you need to contact me directly on it, feel free. This is United.
So United has March Vision as their
Yes
provider. So is it a March Vision issue that should be reached out to them, or is that something that United controls that contract and you are the point person for that question?
So March Vision is a great starting point for that. March Vision and we collaborate very succinctly, very consistently. So if you reach out to March Vision, we can get together. I know that Ann is on the call from March Vision at this time. So we can get together on that if that question comes up.
Okay.
So either
So
one
if
of
you'll
us
just-
can help.
If you'll go ahead and drop your email in the chat box for me, that'd be great.
For sure.
Okay, well then we at least have people that we can discuss this with DMS. So we'll forward that on to Jeremy and then revisit this if necessary at our meeting in November.
Thanks.
So thank you. So Dr. Compton, Dr. Upchurch, Dr. Sawyer, do you have anything else to add to today's meeting?
I do not.
I do not either.
I do not.
All right, wonderful. Then I will entertain any notion that you gentlemen have to conclude this meeting.
I'll make a motion we adjourn.
I'll second.
All right. Okay, wonderful. Thank you too. Thanks everybody for joining, and we will reconvene in November.
Thank you.
Okay, thank you all so much.
Thank you all.
Take care. Bye-bye.